Anyone who thinks that wearing a mask or keeping their distance doesn't help, you are just wrong.
Powerful words tonight from our state's top doctor. By now, most of us are used to wearing one of these, a mask. I'm not near anyone at the moment, so it's not necessary to have one on. But since the beginning of May, we've been required to wear a mask indoors when we cannot social distance. But why do some people still refuse to wear a mask? And what is the science behind wearing one? Since May 1st,
you're not wearing your face covering, you're really being selfish.
This is what we've heard.
Masking up is an easy, simple, selfless act.
From countless leaders.
If you're not wearing a mask in public, you're endangering everyone around you. So the enemy is you.
And even lately, the President of the United States.
If you can, use the mask. When you can, use the mask.
Yet in this country of freedom of speech and expression,
it's none of your business.
We also hear this.
This is a free country.
People marching at Capitol buildings against wearing a mask.
We don't want to be told how to live our lives. We don't want to be told to wear masks. If somebody does, yeah, that's fine. Everybody's got their choice.
But don't just take what you hear from leaders or protesters.
We've started late March. We recovered by early June.
Take it from those who continue to fight the COVID-19 pandemic and the science behind wearing a mask.
There's multiple studies, even inside the U.S., outside the U.S., that showed using a mask has decreased the spread at very high numbers.
But a mask doesn't necessarily protect you. It's meant to protect others.
So the more widespread of mask use, the less of the chance of the virus being spread.
Leaders and doctors also say wearing one is the cheapest and easiest way to fight the virus.
Using a mask doesn't cost much. It might be uncomfortable, but it's least costly on our country, on the economy, on our kids' school, on colleges and everything. Life could go on with a mask.
And debate over wearing a mask will continue. You are still required to wear one in public places in Illinois and now in Wisconsin. But there is a reason for wearing a mask. We break down the science behind it. Virtually every state health department and the CDC suggest that you wear a mask when you cannot social distance. But why wear one? Simply put, wearing a mask stops the spread of COVID-19. The virus lives in droplets in those who are infected, both with symptoms and asymptomatic carriers. Without a mask, your droplets travel far, up to 6 feet when talking, even farther when coughing or sneezing, and more than 20 feet when singing. Put a mask on, the droplets are forced to stay close to you. They may float a couple of feet from your face, but eventually die off and fall to the ground. So if you and everyone else at, say, the supermarket have one on, everyone is protected. So what kind should you wear? The three main kinds of masks are an N95 mask, a surgical mask, and a homemade cloth one. First, N95 masks are used in the hospital, doctors' offices, nursing homes, and more. These are the masks that keep out and keep you from spreading the most particles. But the CDC suggests that you do not wear these masks in public because they are critical for healthcare workers and other first responders. Next, a surgical mask, also used in the hospital, but much easier for anyone to purchase. They do provide a barrier between you and others, but do not provide full protection from viruses like COVID-19. And finally, a cloth mask or bandana, the least effective, but still effective, according to the CDC. Multiple clinical lab studies show that these masks do work. They provide safety for you and others around you by keeping droplets in. They should and are required to be worn when you cannot keep a safe social distance, especially right here in Illinois. So no matter which mask you choose, you should cover both your nose and your mouth with it. A mask and 6 feet of social distancing are our only ways to fight COVID-19, both here in Rockford and across our globe. For your 13 Weather Authority, I'm James Stratton, 13 News. And for this story, we used guidance from the CDC, the Illinois Department of Public Health, and the FDA. We have all of those resources on our website right now, WREX.com. And it seems that most of us are on board for wearing a mask, no matter our views or ages. A new survey shows 68% of Americans do wear a protective face covering when they leave their home and may be in contact with others. That's according to a new NBC News SurveyMonkey poll, which gathered data from more than 46,000 Americans. First, it broke down that data by political affiliation. 97% of Democrats and people who lean to the Democratic Party say they wear a mask at least most of the time. 70% of Republicans and those who lean Republican say the same. There's also a generational difference. 75% of people over the age of 65 say they wear a mask every time they leave home. The age group least likely, people 35 to 54. 64% of that age group say they wear a mask every time they leave the house. That poll was conducted between July 20th and the 26th. Since April, the CDC has recommended that you wear a mask when not able to maintain social distancing.